This is going to be just a short video on what to expect in an initial therapy appointment. So if you've never done therapy before and you want to have a sense of what you're in for in terms of that initial meeting and experience, this will hopefully give you a good sense of that. My hope is to kind of put people at ease. So if they have any hesitation about reaching out or connecting with someone like myself, you'll get a feel for how that tends to go, or at least how those initial appointments, how I tend to approach them. Now, the first thing is when we meet, whether it's a virtual meeting or whether it's an in-person meeting, the first thing that we have to do is go through the consent forms. And so you may have had a chance to read through them yourself, either virtually or in person, but I am required to go through the finer points verbally just to make sure that everything is understood and clear, and to ensure that you don't have any questions. So that's an important part. Now, for some people, this can be a little bit frustrating because they would just want to jump into the kinds of things that they're wanting help with. In which case, I would just encourage you to be patient, and we'll get there very quickly. For other people, like, this is actually, kind of a good icebreaker because you get to sit back for a few minutes, listen to me talk. You get a sense of my mannerisms and just how I communicate, relate to you, and so on. So that might be a good starting point. Now, after we set the consent forms aside, then we're there to address the issues that you're wanting some help with. Now, before getting too far along there, I want to, just let you know that anxiety or stress or uneasiness about coming to therapy is a very normal thing. That is very common. It's more the case than not, I would say, that people have a certain amount of tension or discomfort about doing therapy. And there are a number of reasons for that. One is that you're wanting help with some problem, some difficulty, some challenge, some distressing issue. So your body's sort of anticipating the possibility of us getting into those difficult issues or concerns or problems, and that may, in and of itself, cause a bit of a stress response, anticipating what we may talk about. And another part is that human beings are made up of a multitude of parts, and it's often the case that there is a part of us that obviously wants help, is looking to move beyond some of the issues that we've been struggling with and challenged by. Otherwise, you wouldn't be seeking out therapy. There is, however, usually another part of us that is so accustomed to coping, that is so accustomed to what has become familiar or habitual or normalized, that it almost just doesn't want to break out of that familiar space. It's almost like the devil that kind of thing. So there is a part of us that almost wants to avoid doing that deeper exploration, even though that may in fact be exactly what we need. So there is usually an inner conflict there as well that can cause stress or tension. And then the last thing is you've never met me before. We've likely never had a conversation before. So, it's quite natural for people to be just a little bit unsure about how that's going to go, whether, the conversation is going to, be productive, or whether, what you have to say is going to be, understood and well received, and all the rest of it. So that is perfectly normal and natural as well. And part of the reason why I do these videos is I want people to just have a better sense of who I am and how I think, and you can listen to me speak and get a sense of all of that before we actually make that first contact. So that hopefully that can put you at ease a little bit. The other thing that's important to keep in mind is particularly for the anxious therapy client, keep in mind that you're the boss. You're in charge here. You're contracting me to help you with something. So I'm working for you. And what that means is that, we don't have to have any kinds of conversations or talk about any issues or themes or what have you that doesn't sit well with you, that doesn't feel like it's in line with your goals. You get to determine at what pace, in some sense, like we find ourselves working together. So just keep that in mind. I can't, nudge you into a conversation that you don't want to have, kind of thing. So remind yourself of that. I know most people are aware of that, but it's just good to keep that in mind to settle some of that anxiety. Now, what does the rest of the session look like? Well, for me, a big important part of that initial meeting is to just try to get a sense of what the problem is. Now, the problem is going to be something that is internally defined. So it's a problem within yourself, a difficulty within yourself. And the reason why we say it's internal versus external is that, regardless of what the world looks like and what it's doing and all the awful stuff that could be going on there, in all likelihood, you and I, we can't change that. We can't really influence that in a significant way, let's say, or we're limited rather in what we can do in that regard. So we're more interested in how how we might change ourselves. It could be even like how we change our responses to what we're seeing in the world. It could be wanting to deal with some distressing mood or bad habits or patterns of relating to people, or wanting to be less anxious, less depressed, more confident, this kind of thing. So in the first appointment, I'm just trying to get a really good sense of what is the issue, or issues, and what are the problems as you might define them. Now, it is perfectly okay to not have that, fully mapped out. And in fact, part of my role might be to help you put words to your experience and help you draw that out and clarify what that problem is. So, it might be just something as vague as I've just been unhappy. And well, how would you put that into words? Well, I'm not even sure. Well, that's, again, part of where I might do a little bit of poking and prodding and try to draw that out a little bit so we can get some clarity around that issue. Related to this is like, how do these problems impact you? How do they affect you? How does it inhibit your life in some way? And so these two items here, the defining the problem and how does it impact you, this kind of relates to something I talked about in a previous video, how not to get stuck in therapy, or how to avoid getting stuck in therapy. And so if we have the goals or the problem roughly defined, and then what's at stake, why this is an issue, how it impacts you, to get some emotional motivation on board to ensure that that's there to do some of the work, then we're off to a good start. If we can do that in the first session, great. It doesn't always happen in the first session, but that's usually where I'm coming from and what I'm attempting to do with the people that I meet with for the first time. So beyond that, if we have time, and that will usually take up a full session, quite honestly, trying to get at the issues, the problem, just trying to understand like what that is and how it impacts you and intrudes upon your life and so on. That will usually take up a full session. But if I have any time beyond that, I'll usually start asking additional questions that, in my experience, that the people that I've worked with over the years that have problems similar to what you're describing, I'll just kind of ask questions to try to triangulate the data points a little bit and see if we have any clues to go on as to like what is the cause of this problem, if there is one, maybe to see if we can remedy that. Now, part of the reason why, again, like we asked to clarify the problem and to have a goal for therapy is that it's kind of like our North Star. It just tells us where we need to be heading, where we need to be, where we want to be focused in our sessions. If we don't have that defined, then the therapy can get a little bit scattershot and it's difficult to maintain that focus. You defining the goals, right? You telling me what you want help with, it also gives me permission, implicitly at least, to ask some of the questions that I would need to ask to try to help clarify, those issues and to try to get at what are the relevant causes at play and what needs to shift or change. So that's going to be really important. So my goal in that first appointment, if I have a good session and everything goes, reasonably well, My goal in part is to have you feel understood, to have you feel like I get it, or at least I'm on the path to getting it. That would be a very good thing, and hopefully instill like just a slight little bit of optimism. Like, okay, he's asked some good questions here. I think we could be on the right track, or at least like he seems to think, there's a path that we could take here. Let's see where this goes. This feels like a good start. Like that would be the ideal if we can get that in the first session. That doesn't always happen. Sometimes it takes a little bit more time than that, but that would be ideal. Now, as we're starting to wrap the session up, usually what I'll do is I'll check in with the client. I'll ask them, like, how was the session for you? Did you feel okay with how things went? Were you feeling comfortable with the kinds of questions that I was asking, or at least comfortable enough? I think I said this elsewhere, but therapy should be a little bit uncomfortable because you're being challenged a little bit, challenged to explore, parts of yourself perhaps that you haven't really had a look at, or things that maybe have some distressing feelings connected with them that could be relevant, in a way that allows you to feel like you're opening up to something. Something has the potential to shift, perhaps. So that process is going to be a little bit uncomfortable. I've used this metaphor elsewhere. It's kind of like going to like a good massage therapist, right? Sometimes they got to get in there with the elbows a little bit. Usually not in the first session, but there's a little bit of discomfort in kind of talking about some of these things. But ultimately, it's for the good, and it feels good, and it's never overwhelming. That's the key. So a little bit uncomfortable, but never overwhelming. And so usually I'll check in with the client, just make sure that we have the right the right pace, the right level of comfort. I might ask them or remind them rather in a first appointment that if anything feels off between us, if anything ever feels like we're moving too quickly or not quickly enough, or if I'm talking too much or too little, you can give me that feedback. And I would take that as a sign of good rapport, that we have that working alliance, that we can kind of communicate on that level. So that's something that I'll often do at the end of a first appointment, and quite often in subsequent appointments as well. So that would be the session in a nutshell, and that takes 50 minutes. So I work on a 50-minute hour. The 10 minutes at the end is still time that you have paid for, and that's the time that I use after our appointment to write notes about the session, to write any comments about potential directions that we can take, about what happened during the sessions, any reflections that I might have on different things that could have happened in the appointment. So, for instance, if I'm worried a little bit about the rapport with a client because they're particularly anxious and easily overwhelmed, then I'll just make a note of that, and I'll kind of remind myself, okay, you need to pace things, just take things just a little bit easy for the time being, until we establish that rapport and things feel a little bit more comfortable for this particular client. If the client kind of brings something up that seems particularly relevant, I'll make sure that I highlight that. If something started to be a topic of discussion, but we couldn't finish it, I'll note that. And so that's kind of what happens in those therapy notes. So that is the therapy appointment, the first appointment, and what you might expect from it. And then from there, I usually meet with people, every week or two. Every 2 weeks probably is what most people prefer. But hopefully that was of benefit to you. If you're new to this channel, subscribe to the YouTube channel, give the video a like, and share if you think that this might be useful or helpful to someone else. And I will see you in the next one.